Oh, and welcome to the Mental Health and Suicide Prevention in Construction, the next dimension in safety. My name is Sonya Bohmann, and I am the Executive Director of the Construction Industry Alliance for Suicide Prevention. We are a 501c3 whose mission is to focus on collecting and disseminating resources for mental health and suicide prevention in the construction industry. You can find us at preventconstructionsuicide.com. So, why is there such a stigma around construction suicide, and why is there such high numbers in construction suicide? For those of you that don't know, construction has a 4 times higher rate of suicide than the national average. And we'll talk about some further statistics on why the numbers are as high as they are and really in what segments they're as high as they are. But there's multiple issues, but really the same root cause that affects construction. And that's that when we think about construction, construction's often thought of as the alternative, meaning the alternative to going to college, the alternative to getting an office job. And that when people enter the field, they often feel like there's a bit of a lack of control over how they ended up in the field. And that construction workers tend to have people think of them as having a low skill level. And it's also a barrier to why people don't necessarily want to enter the trades or aren't as excited about entering the trades. But what we know about construction is that it's a great opportunity, and there's many ways to earn a wonderful living and make a great contribution. And so we have to overcome some of these issues as we continue this conversation. One of the things that when you think of a construction worker, you think of strength and determination and grit, and that sort of rub some dirt on it and get back out there and plow through it at whatever costs. And those characteristics are really what have that hard work and get it done attitude in construction. But they're also the things that create barriers to asking for help in our industry. And they are why our industry has one of the highest rates of suicide. As we go through this presentation, I'm really going to talk about language and ways to destigmatize the conversation. And part of that is by changing the way that we speak about suicide and the way we speak about mental health in general. And it's really important to note here that we all have mental health, and mental health is on a bit of a continuum. And so there isn't necessarily a moment in time where one of us says, "Oh, I don't have that." Because we do. And sometimes we are on the well side, and sometimes we are on the unwell side of that continuum. And being able to know how to balance those things and being able to speak openly and compassionately about them are really how we break down barriers and we start to educate people on mental wellness. Part of that is by destigmatizing the conversation around suicide. So we no longer use the term committed suicide. Committed brings lots of negative connotations with it, some of which is that you have committed a crime. Up until the 70s, suicide was actually a crime in the United States and still is in many countries. Or that you have committed a sin and therefore have taken your illness to a level that can't be brought back. And so to destigmatize and to really make passionate or compassionate conversation around this, we've changed the vernacular to died by suicide. And that's really overall in the conversation about suicide prevention, to make this more accessible to conversation. We also have tried to remove some of the labeling language that goes with suicide, such as they are bipolar or he or she is crazy. We say things like they have bipolar or they have a mental health diagnosis. And we also want to refrain from things like weak or selfish or putting a positive spin on whether or not an attempt was successful. So we don't want to say things like it was a successful attempt or they were unsuccessful in dying by suicide. We just simply say there was an attempt. And that really helps us allow us to be able to talk about this more openly and honestly. So, why do we need to address mental health in construction and in the workplace in general? Why is this such a conversation? Well, in 2017, nearly 30,000 people of working age died by suicide. And that's a 40% increase in less than 20 years. The suicide rate in the US is rising, and construction workers are at a greater risk of suicide than the average worker. Male construction workers have a suicide rate of 65% higher than all other US workers. And we'll talk about this as we continue to move forward, but the national average for suicide is it is the 11th leading cause of death in the United States, and males, specifically white males, have a higher incidence of suicide than their counterparts. As I said, it is not just a construction issue. It is really societal. And what we need to know is that, you know, if our workers are not necessarily being affected by construction on the job site, then we need to be aware of the fact that it is touching their lives in many other ways. They say 1 in 5 of us will be affected by suicide at some point in our lives. So it's not happening on a job site. It is touching their lives in many, many other ways. And what we really need to do is rethink about how we focus on safety. So in 2018, 1,008 construction workers died by the fatal 4. But what we know is that 5,242 construction workers died by suicide, and that's 5 times that average. So it's really important for us to be having these conversations on our job sites, in our workplaces, and wherever we gather together. And it's a top-down approach that everyone in the organization needs to be focused on, and everyone in the organization needs to be talking about. So why is construction at such a higher risk? What are some of these risk factors, and how do they play a part in this conversation? Well, we know that chronic pain is a huge risk factor, and there's many reasons for that. But what we know is that construction is hard on our bodies, and that the average worker has 27 years of experience, and 27 years of experience doing the same job over and over can be tough. And that when our workers are injured, they are often prescribed opioids for that pain, and that plays a part in the conversation as well. And we'll talk about that in greater detail as we go along. But there's a lot of pressure in this work as well. You know, we've often heard that you're only as good as your last project. You're measured by the margins that you get. You are only as valuable to the company as the project that you are working on and where it comes in on a numbers line. We've heard all of these things, but the fact is that there's a lot of pressure that goes into building jobs and getting them done on time and on budget. And then there's promotion of supervisors without leadership training. So we often will move someone up the ladder in construction, and they will go from being a worker to a leader in a very short amount of time. But in all of the things that get trained, we focus on the physical safety, but we don't necessarily focus on the psychological or the leadership training that goes into someone now being responsible for employees and their employees' well-being as well. And then there's skills gaps. Just like those barriers of entry into the industry, once you're within the industry, then how do you move up? And what does that look like? And what does someone feel like as they're trying to understand that process within the job that they're doing? Other risk factors are that stoic, tough guy mentality that we talked about, the things that make construction workers unique and great at what they do are also the ones that get in the way of asking for help. There's separation and isolation. We often will have our employees traveling over the holidays or to remote job sites or gone for long periods of time, and that takes a toll. Then there's layoffs and financial instability, where that sometimes is part of the equation. And we work some of the months and we don't work some of the months. And have we had a chance to teach our employees what to plan for and how to be fiscally responsible in those times when there isn't work. And then, of course, there's access to lethal means. There is veterans in the workforce. The construction industry is a great place to land as you're coming from the communal being of being in an armed forces to looking for a space to work. But as we all know, veterans in the workforce come with their own set of risk factors as well, coupled with the ones that apply just to construction, and it really does add up. Then there's alcohol and substance abuse, whether that is from a prescription or whether that is recreational, or it is recreational use to sort of medicate oneself. And then there's demographics. As we've talked about in that previous slide, men are at higher risk than others in the group, especially in the age group that fits our construction demographic. There's sleep deprivation or disruption, meaning sometimes we work days and sometimes we work nights and sometimes we work days and nights. And we know that our body heals during those times. And that's a tough place to be missing out on. You often hear about new moms talking about sleep deprivation and what it does to them. It does the same to our construction workers as well. And poor access or utilization of behavioral health care. Now, many of us have EAPs, but do we know how to use them? And if you don't have an EAP, do you have a health insurance plan? And what is the coverage? And is there an understanding of how those things work together? I think a statistic that I read is that less than 3% of employees actually access the health insurance or EAP plans that they have available, especially from a mental health standpoint. So understanding what those coverages are and how to use them could certainly benefit those risk factors as well. And then, of course, there is creating that culture of care that goes with that. So if there are risk factors, what do we do as employers to be able to balance out what we can support those risk factors with? And part of that starts obviously at the top, and that is that leadership has to be engaged in this conversation. They have to be willing to discuss the fact that suicide prevention and mental health is a conversation that has to happen in our businesses, just like physical safety does. That injury management program, return to work and pain management programs need to be in place, whether that is a second chance program or it is a lesser duty program that we're applying to this, but understanding that there is a way to integrate our employees back in that keeps them safe. And when there are prescription issues, that we have programs in place to address that and to be able to look at it from a perspective of wanting to help versus wanting to discipline. Considering employees and their needs, especially when thinking about traveling employees or them being away for extended periods of time, and making sure there's ways to get them back to their communities or to their families or whatever allows them to have that grounding relationship. Creating encouraging peer support relationships, building stronger teams. What information has come out most recently is that one of the strongest ways to support your employees is to have a peer-to-peer engagement or support team available. It is often known that when we talk to people that are like us and that are going through the same things, we tend to be more open and we tend to be more honest and vulnerable, but we also tend to get a lot from those relationships because you can see that there's others that are going through the same things that you're going through. Personal finance management or education, sharing with their employees how to plan for the more complicated times when there is not work, how to get through those gaps in employment, and to plan for the long term as well. So that doesn't necessarily just include layoffs or separations, but things like retirement planning and 401ks and the long-term look at how to be able to take care of yourself. Reducing job site access to lethal means, whether that is access to the ability for someone to access those lethal means themselves or for the job site to become someone else's lethal means. Gun safety education. And we're not talking about gun control here, But we know that that demographic that fits the construction worker often also falls into the higher usage of guns, and making sure that there's safe storage of guns and safe interventions available should someone be feeling like they need to utilize those. Confirming access to benefits, teaching people how to access their EAPs and access the benefits that the company may already have in place. And if they are a contractor or a subcontractor, what that looks like for them to be able to access some of these resources as well if they don't have an EAP. Substance abuse education screening programs. I mentioned before, second chance agreements, so that if someone comes forward and says, I feel like I have an issue, that it doesn't become a disciplinary conversation, but it becomes then a assessing help conversation as well, and making sure that there are screening programs in place if somebody feels like they may be edging too close to the line of an alcohol or substance use or misuse. Staff projects appropriately, making sure that there's reasonable expectations and that people aren't feeling pinched to carry the whole job themselves. Training managers or supervisors to look for soft skills, to be able to educate themselves on how to communicate with their staff, what to look for from their staff, what to look for the difference between whether someone is presenting signs of mental illness or mental distress, or whether those are performance issues and where the overlaps come together. Training employees to reach their full potential, meaning the rest of your team knows what it looks like to be able to grow into additional responsibilities and how to train for those responsibilities so that they can reach their full potential, but really have an opportunity to grow within a company. And then building in veteran protective factors, making sure your veterans understand that you respect that they are a unique piece of the workforce and how, as a veteran, they can access their own benefits, but the benefits that you also have for them as well. And recognizing what that transition from the armed services to civilian life looks like and the pressures that apply to that as well. There is a interpersonal theory of suicide. It's called Joyner's interpersonal theory. And what it does is it takes sort of the thought process and then it builds on where they come together. So there's a perceived burdenness that the world would be better without me. And then there's that throttled belongingness or that feeling of always being alone and not having a connection to anything, mixed with the desired or the acquired capacity for suicide that I'm not afraid to die. And that brings together sort of where those three converge is the thoughts or the desires for suicide, and really where someone is in a place to make an attempt. And that's where the overlap begins. And so as we add in those protective factors that we talked about is where they apply. So for that throttled belongingness or that I'm alone, the things that you can layer in on top of that as protective factors are encouraging peer-to-peer relationships, creating social connectiveness, watching out for people at all times of the relationship, or as their relationships change. So having connections to know that someone's going through something and how you can, when they're going through that, make sure you're supporting them appropriately. From that perceived burdensome standpoint, or that the world would be better without me, is adding those protective factors of management support, having management understand that people sometimes need to know that they're not just as good as the project that they're working on, setting realistic expectations, and then having constructive corrective actions, meaning that it's not always a last chance, but that you'll work together to look for solutions so that the workplace and the person involved can be better. And then that I'm not afraid to die. And that's really making sure that there's trauma exposure reduction so that if something does happen on a workplace, that we're addressing it immediately, and that there's crisis management in place so that we're addressing that before it comes to a head as well. And if we were to align with the physical safety side of this, we want to look at it as an upstream, midstream, and downstream approach here. And from an upstream standpoint, you want to create a caring culture, one that is open and willing to have conversations about this, applying preventive factors, identifying and promoting resources. So that may be things like 988 stickers or information throughout the office or on high risk buildings or in places where someone might need to be reminded that it is okay to not be okay. Making sure that there's mental health literacy. So if that's basic education on mental health or small trainings, toolbox talks, whatever that might look like. And then midstream is education on warning signs, making sure that everybody knows what those warning signs look like and what to do about them. Early identification, sharing that there are resources to be able to take a mental health screening out there. And then there's the connection to care. What do those resources then look like? How do you access those resources? And that there is no punishment that comes from those resources. And then the downstream approach is that managing of crises, making sure that if there is a crisis, that it is discussed openly, honestly, compassionately, that there's restriction to lethal means on job sites, providing resources to anyone that needs them, that there's crisis response management, and that there is often other support that is brought in at a time of crisis to help support throughout the process. So when we talk about recognizing those signs, what are those signs and how do we recognize them and what do we do about them when we do recognize them? So they really fall into three buckets, and that's what people are saying, what people are doing, and what happens in their lives. And the three of those things apply in certain ways so that we can fall into really having an understanding of what to look for and how to be able to manage that. So, what are they saying? Well, they may say things like, I'm feeling trapped. They may say things like, I want to die. They may say things like, I'm a burden to others, or, some that aren't listed here is that I don't want to be here anymore. They may also jump to conflicts or jump to confront their coworkers much more than they normally would. Things that they are doing is an increased tardiness or absenteeism or even presenteeism. And there's some really strong statistics out there that talk about employees that come to work that are there but aren't really there, and what it is in terms of a cost standpoint, as well as what it does to overall morale of the other employees as well. There's that decreased productivity or problem solving. There's near misses or hits from safety incidents. There's misuse of drugs or alcohol that you may notice more on your job site. So you may notice the guy or gal who comes to work typically on time is now late or is late and showing up smelling like alcohol or things like that. Certainly things to start to be concerned about. They might be acting anxious or reckless or agitated more often. Or the reverse of that is that they may be withdrawing from social interactions. And so the person that used to always hang out is now not hanging out after work, or is not sharing their personal stories, or wants to eat by themselves or in their cars or whatever that may be. And then you may have extreme mood swings where they're happy one moment and completely withdrawn the next. Couple that with what's happening in their lives. Are there relationship issues happening? Are there major life changes that are happening? Is there loss of a loved one or financial difficulties? Maybe they've just gone through an injury themselves or an illness. These don't necessarily show up individually, but they may show up in a combination of each one of them. And it's really important to start tuning in and not just start thinking, wow, this person's just turned into a jerk, or, I don't know what's going on with them, but they're not someone I want to be around anymore. This is really where we need to tune in more than ever and try to figure out what's happening, because these are symptoms or signs that are not typical of this person and really make us want to say, or need us to say, like, what's happening here? And then there's the performance issue side of it. And this is really where we have to start looking at, is this a mental health concern or a performance issue? And not just immediately jumping to the fact that it's a performance issue that requires discipline, but it may be a performance issue that requires more conversation or some digging. Specifically, if you've got that go-to employee who has been your one person who could solve any problem for you and simply now is unable to do that, who just can't seem to pull their collective thought process together, or someone who has a lack of self-confidence. So someone who's always been willing to volunteer to do things first, or is open to being that person that would lead by example, is now shying away from being the person in the front of the conversation, who says things like, I don't matter, or I'm not worthy, or I'm not good enough. Decreased productivity. If you've got someone who has continuously been the one that has led the charge or has been a top performer and now suddenly that's changed, it would be concerning and necessary to figure out why that person has had a decrease in productivity. People don't suddenly become lazy, right? There is a reason that leads to that. And then increased tardiness or absenteeism. Depression and anxiety lead to absenteeism at great rates. Increased conflict among coworkers. If you've got someone who's typically even-keeled and is not one to be emotional or to be conflict engaging, and now they're suddenly jumping to conclusions or racing to conflict, it's certainly something to start asking some questions about. And then there's that capacity to sort of walk the line from the physical pieces of it. So there's near hits or incidents or injuries or even increased hits or injuries, and having concerns about the risk taking involved in that. So how do you respond? What do you do when you see one or more of these things? And it's really following a task method. This method is developed by Living Works training. There is a Living Works training, which can be taken at preventconstructionsuicide.com. You can get up to 5 free licenses for your company there. And this one is called the START training, and it really allows you to start having the conversation about mental health. And they follow this task method, which is to tune in, ask, state, and then connect. So what do we mean by that? Tune in is when you notice or sense that the person might need help, really focus on what those warning signs are, pay attention to them, take note of them so that you can then use them in part of the conversation. And you can be really specific about what you're noticing and how you want to address it with the person that you're concerned about. And then ask if they're thinking about suicide clearly, directly, calmly, and without judgment. What we know is that asking someone if they have a plan or asking someone if they're thinking about suicide will not put the thought in their head. It will do just the opposite. It will actually create the space and time potentially needed to be able to reset their thought process. So when someone is thinking about suicide or is having suicidal ideation, it often becomes a single-minded focus. And if we are able to break that cycle and add some space in there and create some time between the thoughts that they're having and then being able to carry out those thoughts, that's really where we are able to save lives. Being able to have someone connect to those protective factors and making sure that they know that there's someone that cares about them and that is an ally to them really does start to allow us to save lives. And then state for them very seriously that you know that suicide is very serious and that you want to help them through that and that getting help is important. And then connect the person to the resources and to someone who can help them through those first aid skills, making sure that you stay with them, that you get a commitment to safety, and that you connect them directly to where they need to be to get the future help that they need. So how does that conversation look? Obviously, we all know that it's tough to have this conversation. It's tough to ask someone that you care about, are they thinking about suicide? And that's not always the first question, right? We want to start with something as simple as, are you okay? However, what will happen is that you often hear, just like we do on a regular basis, when you say, are you okay? Or is everything all right? People say, I'm fine. I'm okay. It's all good. And that's not what they mean. So our first instinct is always to protect ourselves a little bit. So we throw up that wall and we say, I'm fine. So that's where you go back to some of those warning signs that you learned a little bit earlier, and you make the question more specific. So, hey, are you okay? I'm fine. Well, I noticed that you've lately been jumping to conflict a lot more than you're used to. Like you snapped at Sally and you snapped at Bob today, and that's not normal for you. Are you sure that everything's okay? Do you want to talk about it? And you encourage them to have an open conversation, and you listen with an open mind. So we suggest that you ask twice and that you wait for the answer. You listen, you encourage them to talk, and you really check in to make sure that they are open to the conversation and continue to follow up with them, because they're going to tell you that they're fine and they're going to tell you that everything is okay. And it's important that we're making sure that, we're really diving deeper into that. Now, before I talk about some resources and how to, once you've started that conversation, I think it's really important that we look at the role that opioids play in all of this, because I touched on it as I was talking about some of those risk factors, but it's really important to layer that conversation in here, because what we know is that injured workers in all industries often are prescribed opioids. As a matter of fact, according to the CDC, 1 in 4 are prescribed opioids for long-term pain management, and that they will become addicted. And that 72% increase of suicide and 29% increase of risk and drug-related deaths for men who have long-term opioid abuse. And it's even more significant in women. Construction workers do have one of the highest rates of injury compared to other industries, and they are often prescribed opioids to counteract that pain. There are about 16,000 opioid deaths from prescribed, and then 68,000 opioid deaths overall. So there's about 50,000 deaths that are for unprescribed opioids. And there is legitimate usage, but we also know that those legitimate usages will add to delays in recovery. They will increase medical costs, and they do make that long-term disability even more of a reality. But the long-term effects are staggering. And that is that for every 1 day that you're on an opioid, there's a 6% chance that you're going to continue using that drug a year later. And it just increases exponentially from there. But long-term use leads to the increased perception of pain. It increased risks of depression, and there's increased risks of suicide. So it's really important to, as an employer, provide alternatives to pain management. And as someone who is experiencing maybe some of those injuries, to look at other alternatives to find ways to protect not only your physical health, but your mental health as you go through a recovery process. Some of the things that are important to access in some places that you can get help or that you can get help for somebody, is the suicide prevention hotline. It used to be a 10-digit number, and it has now been reduced to 988. If you're not familiar with what 988 is, it is now the suicide crisis or lifeline. What happens when you contact 988, and you can do that either by phone, by text, or by chat. They can answer in 250 languages, including ASL now, is that you will be connected to a crisis resource based on the area code of the number that you're calling from. Once that happens, is they'll go through a little bit of some questions to try to figure out who best to have help you through that conversation. And then you'll go through a process of de-escalation, meaning the person on the other end of that line will do their best to get a commitment to safety from you. In 98% of the cases, they are able to do that, and there is no further intervention that is needed. In some cases, they are unable to get a commitment to safety, and they will require further intervention. When possible, it will be through a crisis response team, and when it's not possible, it will be first responders that are sent out. But they do their best to be able to de-escalate that call, get someone a commitment to safety, and then get them in touch with the resources locally to them to be able to get continued help. Another great resource, if you're not willing to have a conversation, is that you can use the text line, and that is 741-741. It's free, confidential, just like the suicide prevention line is, and you're able to reach them for help as well. And they can be used 24/7, 365 days a year. The great thing about both of those lines is that you don't have to be the person who's in crisis, that you can actually be someone who is looking to help someone who's in crisis. So one of the ways that you may say to someone that you know that is struggling is, now that you've shared this with me, I want to get you some help. You can either contact your EAP, or you can reach out to the crisis helpline, or we can do it together. And so you may be the person who is reaching out for that person in the sort of the intermediary during the conversation. And that's completely okay, is making sure that together you're able to get that person the help that you need, and be there to help them walk through what those resources look like, and to be able to get them to the help and connections that they need as well. We do encourage you to go on to preventconstructionsuicide.com, take our stand up pledge to stand up to prevent suicide in the workplace. We do have multiple resources there for you as well. If you are a company trying to figure out where you are in the process of suicide prevention, it may be that you go on and you use our integrative tool or assessment to figure out what resources you have in place and what resources you need to add to the mix. We do have the free training that I mentioned, which is the Living Works training. And then we also have a MindWise screening tool where you can go on at any point and take a free mental health screening to see where you are in your own mental health journey, and feel like if you need further resources, you then can access them from there. I hope this was engaging and helpful information. And if we can help in any way, please feel free to reach out to us again at preventconstructionsuicide.com. Thank you.